Welcome again to another episode of the School of Airway. So, this is a topic that keeps coming up when people try to protect the airway. People try to back up a patient with a BVM, and try to do something called crate pressure or Selleck's maneuver. They're still confusing that with ELM, external laryngeal manipulation. Two different things. Again, two different things. One is to prevent the passive regurgitation from the stomach into the esophagus, but never meant to stop active vomiting. Get active vomiting, you're going to get BOHAVs, you're going to get esophageal rupture, mediastinitis, you're going to get the wonderful Hammond's crunch that I've never heard of, never heard personally on a patient in my 12 years as an attending and 4 years as a resident. So, again, big difference. Selleck's maneuver, cricot pressure, prevent passive regurgitation. ELM is to help me get a better view of the cords. Okay? Better view of the cords. So that people use bimanual laryngoscopy because usually this is actively done with the laryngoscope in the mouth. I try not to use the word bimanual because I confuse that with my other bimanuals for a different orifice. Delivers babies. Alright, so I'm doing ECM, driving the blade as far as I can into the follicular. This is my view. I'm trying to get an improved view of the cords. This is not cricot pressure. This is not Selleck's maneuver. If you have to, you'll yell at someone and say, yeah, whatever, because you can't teach them that split second. Then you'll have to go on Google and show them this is what you really mean, right? All right. Again, very important difference. Okay. I'm going to talk eventually about an article that came out that with fluoroscopy and with anesthesiologists, they were able to ascertain that with even anesthesiologists doing the Selleck's cricot maneuver, they were too lateral, too medial, too deep, pressing too hard, too shallow, too low, too high, and pressing the area that they're trying to press on the cricot ring into compressing on the esophagus. Mind you, there are a lot of normal variants in humans that the cricot pressure, the cricot area of the larynx is not directly overlying the esophagus. If we were perfectly designed that way for every human, it would probably work more often. But sometimes the esophagus is to the left, to the right, and sometimes we miss in what we're compressing, right? It especially happens if you try to use one finger, 2 fingers. You're probably better off using your whole hand, at least 3 fingers. But even then, that's to prevent passive regurgitation, not to aid your intubation. Okay? If you don't want to educate anyone, you'll let people continue with their nonsense of saying cricot pressure, but you're really trying to say ELM, external laryngeal manipulation. Okay, as taught by Dr. Levitan. Please come back for another episode of School Airway. Bye-bye.